Addis Ababa, Ethiopia, modern and ancient, side by side. It's one of the most significant diplomatic capitals of Africa, center of the African Union, and headquarters of the United Nations African Mission. Yet it remains one of the world's poorest nations. And access to health care for the poor is extremely limited.
80% of the surgical needs of the world is not met, and majority of that need is in Africa. In Ethiopia, for 80 million people, there's only 1,000 doctors, and most of them are in Addis. Out of those 1,000 doctors, 200 are surgeons.
My name is Miliar Derbo. I'm a pediatric surgeon. I've been doing pediatric surgery for the last 12, now 13 years. We have very much limited number of pediatric surgeons in this country. Till last 3 months, there are only 2 pediatric surgeons in the country. For a population of 80 million, which is predominantly a pediatric population, which is 45% of the population below the age of 15. So this is a pediatric society. It's a paradox to have a pediatric society without having a pediatric surgeon in the country.
Dr. Durabo is also the Dean of Faculty at Addis Ababa University Medical School. The school is based at Tikur Ambessa, Black Lion Hospital, the largest teaching hospital in Ethiopia. People from all over the country come here hoping to receive treatment. Often they are told they can't be helped, sometimes because the waiting lists are too long, or because the technology is not available, or because no one has been trained to do the necessary procedures. In February of 2009, Dr. Darabu and Black Lion Hospital were the hosts of a contingent of more than 50 surgeons, anesthetists, nurses, and volunteers who came to Addis Ababa to perform free surgery and to hold training seminars in various disciplines. Black Lion Sunrise is currently being edited. It tells the story of a 14-day surgical mission in Addis Ababa that changed the lives of hundreds of people and left a legacy that will transform the lives of thousands more. The purpose of the mission was twofold: to provide free surgery and hospitalization for the underserved, with a priority given to difficult cases which required surgeries that the local surgeons had not been able to perform, and also to provide training both in a classroom setting as well as informally by doctors and nurses working together in the operating room. The World Surgical Foundation, based in Harrisburg, Pennsylvania, organized this mission. Since 1997, they have sponsored dozens of missions to many locations in Asia and Central America. This was their first effort in Africa. Dr. Dam Alviar is the founder and president of the foundation.
My vision is to form strategic partnerships with other organizations that have similar vision with the World Surgical Foundation.
One of the strategic partners on this mission was the International College of Surgeons. They were represented by several individuals, including the current president of the U.S. section, Dr. Wiki Vigneswaran.
The International College of Surgeons has 62 chapters around the world, and we have members over 110 countries. Because the World Surgical Foundation and the International College of Surgeons had same mission goals, and it felt that it would be a good affiliation for both of us. And this is the first major trip overseas we are doing together as a joint venture.
Dr. Jay Baticha, an OBGYN surgeon from Hayward, California, is the president-elect for the International College of Surgeons.
A teenage girl has a very large pelvic mass, probably ovarian. Hopefully benign, but there's a chance that it may not be. So we'll see what we find there.
And Dr. Maxime Coles, an orthopedic surgeon from Coffeyville, Kansas, serves as a world governor of the International College of Surgeons. Black Lion Sunrise is the story of the doctors, the nurses, and the volunteers who shared this 14-day experience, and the bonds of friendship that were formed. But mostly it is the story of the children whose situations have been turned around, allowing them to live happy, healthy, productive lives.